Hello, everyone. I think we're still waiting on a few more attendees, but I'm going to go ahead and get started. Thank you, and good morning, and good evening, and good afternoon to everybody. Thanks for joining today's webinar. My name is Nora Abdelgawad, and I am the Program Officer at Resolve to Save Lives on the nutrition team. And I will be kind of introducing and giving a quick overview of today's session. So this is the Data for Action, harnessing the new RTSL Global Nutrition Database to shape healthier packaged food policies is our webinar for the day. I want to just give some housekeeping information. So I think everyone should be automatically on mute if you're an attendee. And if you have any comments or discussion points, please feel free to use the comments section to do that. And then for any questions that you have for speakers, use the Q&A feature, which is available at the top of the screen to direct any question to the panelists. For language and translation options, you can click the top 3 dots on the More button, navigate to language, and then select Turn on Live Captions. A caption box should appear at the bottom of the screen. And you can click the gear icon at the top right corner and select the language. So I'll just paste those directions into the chat, and hopefully that should be straightforward. I will pass it on to our Senior Vice President, Renu Garg, or Dr. Renu Garg. I will allow her to give some opening remarks, and then we'll go into some presentations. I will present on the Global Nutrition Database, and then we have a number of country speakers who will walk through the work that they're doing in this space. So that will be followed by a Q&A session and a discussion. So thanks again for joining, and I will pass it on to Dr. Rain. Thanks.
Thank you, Nora. Good morning, good afternoon, and good evening. Thank you for joining today's important discussion on how data can drive action. No matter where we are, we all have a role in shaping a healthier food environment. The packaged food industry is growing worldwide, but so are the health risks. Many packaged foods are loaded with sodium, sugar, and unhealthy fats, which increase the risk of heart disease and other health problems. This is a serious issue, but the right data can help us find solutions. By comparing packaged foods across countries and against global nutrition targets, we can assess food environments and push for stronger policies. Proven measures like sodium limits, front of package labels, marketing restrictions, and taxes on unhealthy products can help improve public health. Each of us has a role to play. We at Resolve to Save Lives have created a global nutrition database that compiles national data and regional sodium targets, giving policymakers and health advocates the evidence that they need. If you are a researcher or a government official, you can collect and analyze data to shape and enforce better policies. If you are an advocate, you can use this data to push for stronger action where it is needed the most. With the right data, we can turn insights into actions and create a healthier food environment for all. Thank you again for joining today, and I'll turn it back to Nora.
Thank you, Renu. Very important words. I will now just give a quick introduction to the Global Nutrition Database, as we've mentioned. So I will share the slide there. Hopefully they will, yes. Okay. So again, thanks everyone for joining today's webinar. And this is the sort of Global Nutrition Database we'll be discussing today. So just to give some background, RTSL launched the Global Nutrition Database in 2022 as a way of centralizing, creating a central location for category level nutrition data and helping countries track and reduce harmful nutrient levels, particularly focusing on sodium, sugar, and saturated fat. In January 2022, we updated the database with more countries, new features, and improved usability to make the nutrition data more accessible and more transparent. Our goal with this project is to support evidence-based policymaking, advocacy, monitoring, and enabling cross-country comparisons, as well as tracking against national nutrient targets, as well as global and regional sodium benchmarks. The database includes sugar, sodium, saturated fat, content levels by food category for each country, mapped to the relevant targets where available. More work has been done at the global and regional and country level on sodium targets. So we have mostly this information, but where there are national sugar targets, we include those as well. So a quick snapshot of what's on the database. We have currently 56 data sets from 36 countries, including 14 new countries we've added in the most recent update. In the database, there are 43 sodium data sets, 9 sugar data sets, and 4 saturated fat data sets. For the sodium data, we've added comparison tools that can compare category level national data to the second edition of the global WHO global sodium benchmarks, as well as the PAHO updated sodium targets. We plan to include the zero targets as well, but in our next update, hopefully, so stay tuned. We also allow for comparison to national targets where they are set. So in the next few slides, I'll just kind of walk through what the interface looks like, and I hope that you've all had a chance to look through the website itself, and if not, here are the kind of key features, but we do encourage you to take a look. This example looks at sodium data from Argentina, but again, bear in mind other countries and data sets have slight differences in the data that's reported, so this is just one example. On the left-hand columns, you'll see category and subcategory, and those are as reported by the in-country researchers. The mean sodium content for each category is shown in the following column, and the next columns show the value of the relevant PAHO target and WHO benchmark for that specific food category. And then, if available, the last row shows the relevant country target. And just to note that PAHO targets, we map them only to countries in the PAHO region, so that column will show up for a country if it's in that region. For each country reported category, we at RTSL, in collaboration with the researchers, map them to corresponding WHO benchmarks and PAHO targets as closely as possible, which you can see when the data set is expanded. So those are, that's after you've kind of expanded one of the data rows. Each expanded data row shows more summary statistics like median range, where it's available, as well as the specific categories that are mapped from WHO and PAHO. And then each country database has a dedicated web page outlining its packaged food policy response. And then additionally, it has, just if you scroll down a little bit further, you'll see a methods section, which outlines how each data set was collected. Here are some sort of suggested ways in which we hope people will use the database. So for policy advocacy, you can use those cross-country comparisons to highlight opportunities and advocate for stronger packaged food policies. You can leverage that data to demonstrate that reducing sodium, sugar, and saturated fat in packaged foods is, in fact, achievable. Hoping we can use this data to develop strong nutrition policies and establish and update nutrient thresholds used in national policies for packaged foods. You can conduct research using this data, analyzing trends over time across countries and comparing that to the different benchmarks that exist. And you can also use it to track progress, as I mentioned, over time in achieving nutrition goals by kind of comparing nutrient levels over time. So just to kind of quickly move through, I know that I've got a big schedule today. So this kind of gives you an idea of how you can use the data. This is just something that we did with what was on the database at the moment. We examined processed cheese and potato chip categories with reported data in the kind of countries that are shown there. We compared it with the WHO maximum level sodium benchmark, and we found that for processed cheese, none of the countries had a mean sodium content that fell below the WHO benchmark, despite significant variations. And for potato chips, we saw that the mean sodium content in 2 out of 6 countries met the WHO benchmark. So it's highlighting where more efforts are needed. And just generally looking at these, you can see that there's still opportunities to reduce sodium content in packaged food products, and that it helps to see the data across multiple countries for each category, and also kind of reveals that there is a wide range of sodium content within a food category across countries, and that might indicate a level of disparities and a need for more equitable sodium reduction efforts globally. So just in conclusion, this is a free, publicly accessible tool that we hope will support efforts to improve the food environment worldwide. We encourage you to explore the database, see how it can support your work. If there is publicly available data that you're not seeing on there, please do reach out to us and share that data. We hope to have as much data as possible to kind of improve the comprehensiveness of it. And yeah, please give feedback as we work on improving the GND over in future updates. So thank you. I will pass it to Dr. Laura Cobb, who is our Director of Nutrition and Surveillance at Resolve, for the rest of the presentation. So thank you, and I will pass it over to Laura.
Thank you so much, Nora. Thanks. And thank you for your presentation and for all of your work on the database to date. If we could take off the screen. Perfect. So now the next part of our agenda, we will have short presentations by each of our 3 distinguished panelists, Dr. Mary Labbé, Dr. Gazeng, and Dr. Gabriela Flores. That will be followed by a panel. So please feel free, if you have any questions as you're listening to the presentations, to type them in, and we'll give it a chance during the panel for audience questions. So we'll start first with Dr. Labbé. Dr. Mary Labbé is a Professor Emeritus in the Department of Nutrition Sciences at the University of Toronto, where she leads a research group on food and nutrition policy for population health. Her research examines the nutrition quality of the food supply, food intake patterns, and consumer research on food choices related to obesity and chronic disease. And she'll be talking today about using the FLIP database to advance and streamline packaged food data collection and analysis across multiple countries. Thank you so much, Dr. Labbé, for joining us today. Over to you.
Okay, thank you very much. Am I in yet? Can you hear me? Oh, I think I'm getting put in. Oh, yeah, perfect.
There you are.
All right. Well, thank you very much for that very kind introduction. And I'll say good morning, good afternoon, and good evening to everyone. And thank you for joining this presentation today. So I'm going to talk about FLIP, and this is a database we developed in Canada, but it's open for use in many countries, which right now it's used in about 13 countries globally. And next slide, please. As mentioned, why this is important is, as you know, there's been many food policies, and these food policies focus on changing or reformulating foods to meet various targets. And so we have food formulation targets such as sodium reduction. We have front of pack labeling, which also focuses usually on the warning type systems on having foods below several thresholds that have been set by governments. And more recently, we've seen a number of countries introduce restrictions to protect children from unhealthy food marketing, which means that certain foods have to be below certain thresholds in order to be marketed to children, or they're totally exempted. Next slide. So I'll just talk a little bit about FLIP and its overview. If you can move to the next slide. There's actually a number of components of FLIP. It's actually a system. So first, there's a data collection app, which collects your food label pictures from in stores. Those labels are then updated into a database, which is a web-based access. And obviously the leader or the PI of each country would then designate who has access to that database. And then there's space for data processing and for conducting your research. And next slide, and I'll go through each of these parts. So what does FLIP actually look like? It has the capacity to keep a lot of data, although you may or may not want to use all the features. But most obviously it says pictures of the food, and the flip will give it a unique identifier. But you take your pictures of the nutrition information panel, ingredient list, and then because there's front of pack pictures, you can identify if there's any front of pack systems or claims on the food. And then you can identify all the other things that are available with that food, whether you collect prices or not. And also if your country has barcodes, there's an opportunity to collect that as well. And it actually scans the barcode for you right from the app when you start taking pictures. Now, the next site just gives you an idea of what's there. So the first picture in the top left is actually the your login screen that you would get to access the Flip database. And there, either on the website or under the help desk, you can pull out a lot of protocols. And what we've done is we've created protocols for tailored or adapted to each country's protocol if there's slight modifications they want. These protocols are available in both English and Spanish, and obviously we have the capability with translation to put them into other languages if needed. And then in the help desk, there's a number of Excel files that help people to do some of their calculations, whether it's like a recipe database to, for example, the common ingredients. If your recipe calls adding an egg, you can find the ingredient of egg and create the template and create the analysis for you. And then there's all guidelines on how to actually collect pictures, how you get the best quality picture. So all of that is in the user guide. Next slide, please. So the first step is actually the data collector app. Oop, we slipped a slide. The data collector app has been set up for iPhones. And when you go into the store, it's been used like in many countries now. You go first in, you scan the barcode of the food. That tells you whether that barcode has already been collected in your country. You can decide to collect the same food in multiple stores if you wish, or if you've only collected it once and you don't want to recollect it, it'll tell you it's already there and you can decide to skip that food if you're in a second grocery store. But some people want to collect it in multiple stores. And then you have the opportunity to take a picture of each side of the package. And we encourage you to zoom in on the minimum the nutrition facts and the ingredient list. And as you take each picture, you identify it. You can see the third slide, you actually show what you're actually taking the picture of. So you identify it. And that app is used for in-store data collection. And to give countries an example, I would say that from the countries that have used Flip, they have collected anywhere from about 1,500 to about 14,000 foods. It's the typical number, and that's when they've visited 3 major retailers in the country. They often go to a rural and urban and an in-between area. But most countries tend to collect about 15,000 packaged foods when they do a label collection in their country. Next slide, please. I'm going to briefly go through and show you what all the various features of Flip are. So this is the description tab, and always in each of these tabs, you can see the tabs across the top. You always see the pictures of your food, and you can scroll up and down to the pictures. But the first one is just an identification, telling you what the food is. You can put the food name in, where and when you collected it. Next slide. The next is the most important one, and the most important one is a description, continue to the description tag. And this is where all of these are set up by drop-down menus. So you can put the category and identify this happens to be a fruit or a fruit juice, but you can drop down the soups or any other food category. You can put down a subcategory. Now we've set these categories up for Canadian ones, which have actually a lot of detail, but we've migrated, and we have later on, we have all the other tabs, for example, that align with targets that have been set up by World Health or PAHO or other agencies. Next, the ingredients are not placed. Oops, sorry, back again. There's a backslide. There's a place to enter the ingredients. And finally, if you're collecting purchase info, the price, you can put that in. And you obviously identify the price for a package size. Next slide. This is the important tab. This is the nutrition facts information. And this is where you would enter each of the nutrients that you find in your nutrition facts. It also has 2 features that if you want to, for example, change between the serving size and calculate it per 100 grams or back and forth, if you want to, you can do those calculations right in. It actually will automate those calculations for you. And if your food has a recipe, you can also use the density to do calculations, for example, recipes, or just to dilute it with water. Next slide, please. Now there's other tabs. For example, this is a marketing and claims tab. You can go, and as you're looking at the picture, there's drop down. So if there's a front of pack warning or symbol on it, you can identify it's identified as high sugar, high sodium, high fats, or contains high trans fats. So any of the things that may be appropriate to your country's front of pack labeling, you can identify whether they're there. You can identify, and they're all by drop downs or check boxes. You can identify whether you see any marketing to children on that product and any other nutrition or other claims. And there's a whole series of drop downs. Usually there'll be vitamins and minerals, and then you can drop down specific details of that claim if you want. And the next tab, next slide, is specialized tabs. And this is where we've set up, because all the nutrition information is now entered, you can do various nutrient profiling. And we've set up automatically to do calculations for PAHO's nutrient profiling, various country thresholds for front of pack labels. And those are the types of customizations that countries usually ask for. It's quite easy for us to do and very inexpensive. For example, to put in your, like we have the UK traffic light, but we can put in your country's thresholds if you would like there. Next slide. And similarly, we've got set up tabs for sodiums and sugars, and this is where the foods are categorized according to the PAHO World Health most recent targets and the various PAHO ones over the time. So you can see that the opportunity, and you can do this for various sugars if you have ones. And so these are specific tabs for various nutrients and public health concern that either you can use the existing ones or customize them. Next slide, please. Now, I won't talk about that, but we have done a lot of work around AI because our databases have gotten bigger and bigger, and we share these routines. All these algorithms are in our GitHub, but we'll help countries if they're interested in doing these through AI, particularly when you have large data sets for categorizing foods, nutrient profiling, determining the NOVA levels, looking at image recognition is our most recent one, and identifying product matching or marketing on the food packaging. Next slide, please. So with that, I just want to thank everyone. Oh, sorry, building reports. I skipped a group. Okay. Just as the last one, next slide, please. One of the features that Flip has is allows you to build reports. So you can put filters in, for example, which keywords or which food categories or date range if you've got multiple years collections or specific stores. So you can filter your data. You can then select criteria, which criteria you want to export, all the nutrients, just certain nutrients, and then export your data to Excel. And so next slide, please. Just to give you an idea of some of the uses that you can do for food policy. Next slide. Next slide. Yeah. We've done it within Flip in Canada, but we've now got 14 countries through Latin America, Africa, and Asia who are using Flip. You can obviously use the data to see how you're doing relative to targets, but also these data, for example, from a number of countries in Latin America were used in the PAHO region to set the PAHO targets. Obviously, the data have been published in a number of publications. The data in the database have also been linked with national food surveys or sales data to get estimates of intakes, and they've been used in consumer apps, for example, a salt calculator or sugar or a food Flip. In that case, in Canada, it was putting our front of pack labels on foods before the regulations are even out. And finally, and the last slide, I just want to thank you all. If you happen to be interested in using Flip, please reach out to me. And key people in my lab are Lisa Shermel, the Flip database manager, and Haley Yang, who is our analyst who helps countries with their data analysis. So thank you all very much.
Thank you so much, Mary. That was really great, and Flip is a great resource, and we're so excited that quite a lot of the data from Flip is at the category level into the nutrition database that we're sharing. So it's a great it's a really great resource for everyone. And now I'd like to welcome our next presenter, Dr. Gazeng. Gazeng is a very close colleague of mine, and he is the Director of Nutrition Programs of Cardiovascular Health at Vital Strategies China Representative Office. And Dr. Gazeng will be talking about his experience with ongoing work in the developing and monitoring of salt reduction targets in China using packaged food data collection, as well as the process by which the data was collected. So thank you, Dr. Ge, and over to you.
Thank you, Laura. Hi, everyone. I'm Guzeng, and pleased to join the webinar, talk about the China salt target for prepackaged food and nutrition label data. Next slide, please. In China, the daily salt intake is as high as 10.5 grams per day, which is estimated from over 10,000 24-hour urine samples, more than double the WHO recommended level of 5 grams per day. As shown in this chart, the primary sodium source is from home cooking, accounting for nearly 70%, and the contribution from processed food is less than 10%. But the worrying situation is the proportion is increasing over time, and therefore setting salt target to reduce sodium intake from processed food is needed in China. Next, please. The current mandated general rule for nutrition labeling of prepackaged food took into effect from 2013. It regulated that all prepackaged food in China market must carry nutrition labels and to display some key information called 1+4, that is energy, 4 core nutrients, including sodium, protein, fat, and carbohydrate. And National Institute for Nutrition and Health of China, CDC, regularly collects nutrition label information, including sodium content. So this data lay foundation for setting salt target and the evaluation of the implementation effect. To help achieve 20% relative salt reduction target by 2030, proposed by Healthy China outline in a Healthy China 2030 outline in 2016. The guideline for salt reduction in Chinese food industry was released in 2019. They target used the 2016 nutrition label database as baseline and reference. It set an overall 20% relative sodium reduction for both mean and maximum targets, with 2 phased target, 10% by 2025 and a further 20% by 2030. It involved with 7 food categories and 28 subcategories. From 2021, we supported Chinese Nutrition Society to update this salt target based on latest global experience and a nutrition label database with technical support from WHO China office and international experts. So after nearly 4 years effort, the target updation were completed, and a new 20% sodium reduction target by 2030 was set, and the number of food category expanded to 9 food categories and 45 subcategories. To ensure implementation of the salt target, a monitoring and evaluation plan was accordingly developed. This target were officially released in last November, and the book will be published soon in this year. Next slide. Because the targets are voluntary and compared to some countries' mandatory policies, it's even more important to collect data and have evidence, and then to provide these two industry to strengthen interactive communication to help convince them to follow this target. Therefore, nutrition label data will be collected to support the implementation of the target in both national and provincial levels. In national level, China CDC will continue to follow previous food product inclusion criteria, including high consumption products and compliance to basic logic to choose product and take photos of a nutrition label, and then to perform data analysis, understand sodium content status and change over time. In provincial level, we supported Shandong CDC release 3 reduction standard, which determine some healthy foods in China below certain cutoff values of sodium, fat, and or sugar in Shandong food market. And the Shandong CDC has collected over 25,000 records in 4 cities last year by use of an online app. Nutrition label information will be collected based on project progress and requirement. Next slide, please. So for next step, we will support our local partner to conduct the challenging part of SOAR target implementation. So to call for food industry and build their confidence to reformulate their product to reduce the sodium content. We will collect and use the nutrition label data to perform comparison analysis to demonstrate the feasibility of the target, for example, above or below target, and to share results with them through meetings or newsletter. Also to find some challenging food category to analyze reasons so as to provide specific technical support for food industry, and hopefully to publicly release sodium content status and change over time to ensure stakeholders continuous awareness and pay attention to the SOAR target. Next slide, please. And apart from the SOAR target, for the data, they could play a variety of roles in data-driven food policy development and implementation. For example, it can serve a basis for development of other complementary sodium reduction food policies, including nutrient profile model development, setting threshold for food standard to define what food are high in fat, sugar, or sodium, as well as monitoring other nutrient of concern, like fat and sugar related to obesity, and evaluation other food policy impact. Next slide. This is the last one, and thank you all. Look forward to discussion. Back to you, Laura.
Thank you so much, Kazang. And our next presenter is Dr. Gabriela Flores, who is a leading expert in food and nutrition policy, currently serving as the head of the food area of the National Healthy Eating Program at Argentina's Ministry of Health. In this role, she leads national policies on sodium reduction, trans fat elimination, and front-of-package labeling, contributing to regulatory advancements in the Argentine Food Code. I'm so excited to welcome Dr. Flores, who will share her experience in Argentina and ongoing work on salt target monitoring and regular surveillance using packaged food data collected in Argentina. Thank you so much. Over to you.
Thank you. Good morning, good afternoon, good evening for everyone. It's a pleasure to be here today. I would like to thank Resort to Stay Live for the invitation. In this presentation, I will share an evaluation of the degree of compliance with Argentinian maximum sodium limits in comparison with international targets and a proposal for updating our limit basis on evaluation results. The next, please. Excessive sodium consumption is a public health issue. Reducing it's a key to preventing non-communicable disease, particularly cardiovascular, cerebrovascular, and renal disease, and improving quality of life. Argentina has been a pioneer in the Americans establishing regulation to reduce sodium in food. The Law 26/905 was enacted in 2030 and had 5 main standards. Establishes mandatory sodium maximum limits for certain food groups, required warning levels about the risks on the salt consumption on salt packaging, implement action in restaurants such as remove salt shaker from table, offering low sodium menus, and providing dietary salt, and limit the size of individual salt package and promote awareness campaign. The next, please. Okay, no, before that, la anterior. No, la anterior, sorry. Okay. Okay, the next. Since enactment, the law in Argentina has established mandatory sodium limit in various food categories to evaluate compliance with this limit and compare with the international standard. A cross-sectional descriptive study was conducted. The unit of analysis included all food covered the law and registered in the Federal Food Control System. A sample on 80,763 food was initially considered. After consolidating the database, we analyzed a final sample of 7,101 food that had complete information were currently marketing and fell under the regulation. The next, please. The next. Okay, thank you. Once the sample was obtained, we calculate the sodium content per 100 grams. We compare sodium value with maximum limit and categorize product as either compliance or non-compliance. The sample was categorized in 4 regular groups: meat products, broad and soft dressing, and canned food and starchy products, divided into 11 categories and 53 subcategories. The statistical analysis includes median, mean, range, and 25th and 75th percentile for sodium content. We assessed the percentage of products exceeding national limits and international targets by group, category, and subcategory. We compare national limit with the PAHO 2022 and 2025 targets and World Health guidelines. The next, please. The next. Okay, thank you. This slide shows the 4 food groups and 11 categories that have legally established maximum sodium limit in Argentina. The next, please. The results show compliance level in the 4 regulated category, also compliant in below 19 in only 1 group. When compared to international limit, there are clear opportunities for improvement. None of the groups exceed 60% compliance with PAHO and World Health targets, indicate that Argentinian sodium limit needs to be updated. An important point to highlight is that 9 out of the 11 product categories shows a high variability coefficient in sodium content. This suggests that technological feasibility exists to further reduce sodium limits. The next, please. To strengthen regulation, a proposal was developed to update national sodium limits. The strategy was based on comparing the median sodium content for each subcategory with the legally established limits. The greater the difference between the median and the limits, the higher the proposed reduction. Based on this approach, subcategories were divided in 3 groups with proposed reduction on 50, 20, or 30%. This strategy ensures that reductions are both technologically viable for the industry and effective for the public health. The next, please. Argentina has been a leader in sodium reduction in the Americas, particularly in implementing mandatory sodium limits in processed and ultra-processed food. High compliance rate, but significantly lower when comparing to international targets. Only 2 of the 11 categories showed low variability in sodium content, meaning that reformulation is technologically feasible for the most product group. Sodium limit must be continually updated to align with international standards and remaining effective. This proposal is currently being evaluated by the authority of the Ministry of Health now. The next, please. Thank you very much for your attention. I hope this presentation provides value insight into Argentina's effort to reduce sodium in food. If you have any questions or would like more information, please feel free to contact me via email. Thank you.
Thank you so much, Dr. Flores. Great. And so I think we don't have as much time as I had thought initially for questions, but we do have about 13 minutes before we have to close up. So we'll take a little bit of time to ask questions of the panelists. There were a few questions that came in just on the database itself. So I'm going to take a really quick minute to answer those questions, and then once that, then kick over some questions to the panelists. So really quickly, questions that came in were whether or not there were any plans to include trans fat in the data, whether the database can be used for tracking, and how comprehensive and regularly updated is the database in capturing branded foods and their nutrient composition, and how does it support policy monitoring? So I think just the really important thing on the Resolve Global Nutrition Database to mention is that it is a category level database. So it really does not have products at the branded level, and it does not have product information. And part of that is just a technological capability issue. We just simply didn't have the bandwidth to build a product level database. But also because so many researchers work so hard on putting their databases together, and they have a real interest in publishing from them, it's much easier to collect the category level data, and that way it provides some access to the public, but it also allows the researchers who collected the data sort of the more detailed access. So what we have in the database is largely sodium related because that's what's been made available publicly. We would be happy to add trans fat if that's sort of available at the category level. However, because the goal with trans fat is to ban it, usually it's not generally sort of collected and shared at a category level in that way from packaged food data, although it could be. And just to say, in terms of tracking over time, where we can, we have data sets over time. So some countries like Argentina, for instance, we do have multiple data sets, so you can see whether there's changes over time, and we hope to build that out going forward. So I'm going to ask a question for Dr. Flores. Does Argentina's regular surveillance system capture shifts in sodium intake and food reformulation trends to guide policy adjustments?
Okay, I go to respond in Spanish, translate for me. En Argentina, la política empezó hace 16 años. El consumo inicial de sodio en nuestra población era de 11.25 gramos y ahora es de 7.9 gramos. Esto se chequea a través de encuestas nacionales. Y en cuanto a la reformulación de alimentos, lo que se sigue es las evaluaciones respecto al cumplimiento de los límites a través del Instituto Nacional de Alimentos.
Thank you, Dr. Flores. And I believe Luis will translate that to English. Can we bring Luis on?
Yes, thank you so much, Laura. So what Gabriela has just mentioned is that the sodium intake in Argentina, when the policy started in 2013, was higher than now. So the sodium intake has reduced over time. And then the reformulation is measured by establishing if the food products are compliant with the maximum levels established in the regulation. So the national registry doesn't allow for, let's say, reformulation assessment over time, but only compliance with the actual limits that are established in the regulation.
Thank you both. A question for Gizeng. Is China's survey methodology and databases robust enough to capture variations in prepackaged food consumptions and accurately track progress towards sodium reduction goals?
Thank you. And in China, there is one cohort study, and cover in nearly half of provinces in China, which continuously collect prepackaged food consumption. So in my first slide, the reference I mentioned, the proportion of sodium from processed food, is from this cohort. But China food market is complex, and over 85% are middle to small size food company, and I think over 40,000 companies in China, and existing geographically difference. So there are some challenging, especially considering product brands and sodium content of product change over time. But for the salt reduction goal, I think there are two levels. The firstly, the population level. So for Chinese government, the China Healthy China 2030 goal, 20% reduction, and possible we will use the cooking salt change to evaluate the target, because for the National Health Commission, they publish the salt intake from home cooking. And for salt reduction goes for prepackaged food. So this will be evaluated by collecting the prepackaged data set, the nutrition data set, and to evaluate it. So there will be some different methods and by different team. For example, in Shandong province, and they have already tracked the change of sodium content from in past 10 years by collecting the nutrition data from supermarket and twice. And I think in China for the national level, and we will work with China CDC to collect the nutrition label data again, and to evaluate the change of sodium content, and to evaluate the goal, whether it's achieved or not.
Thanks so much. And for Mary, can you share an example of how FLIP data has directly influenced either a country's food policy or reformulation efforts, or the ability to monitor those efforts?
Yeah, basically in two ways. One, I'll use Costa Rica as an example. When they first started coming up and trying to develop national targets for sodium reduction, they actually had their first set of sodium collections in the country with FLIP, and that data was used to set their national targets. Their targets were set at about 75% of the mean of what they were seeing. So in other words, they were trying to get the top 25% of their food products below the levels that we found in that first data collection. And then, so that was done in a number of countries. We did the same approach for setting the targets in the PAHO region. In that case, we used data from about 15 countries who had sodium data, and used that same approach, but used the mean of the countries and made sure that every country at least had a portion of their foods below the targets to set that target. And then, of course, because we've set 2 sets of targets, we had data that were collected in the early 2015, 2016, 2017, and we've had data collected since 2020, 21, 22. So we do have a number of time points that data has been used in a number of countries. I must admit, though, unfortunately, not every country has the capacity or the funding to keep repeating the data collections. And also, we're bringing new countries on board. So it's a collection of both new countries who have no data, collecting data to help establish their policies or to see how their country is doing relative to either PAHO or the WHO global benchmarks. So many countries don't set their own targets, but they needed that data to show how their country is doing and to advocate for stronger policies in country. And then other countries have had the funding and the capabilities to collect several data collections. So it's a mixture of both new countries getting data and other countries having recurring sets of data every 3, 4, 5 years or more often, depending on their capacity and capabilities.
Thanks so much, Mary. And one final question, I think, for Gazeng. Beyond sodium monitoring, how is China leveraging its packaged food data for other nutrition policies, for instance, front of pack labeling, marketing restrictions, or taxation?
As I said that, sorry.
No, go ahead. You're not anywhere.
Okay. As I said that, as I mentioned in my slide, actually the nutrition label data is provide the basis data for different food policies, and including the FPL and nutrient profile model. And actually in China, we also collaborate with the UNICEF and support Chinese Nutrient Society to develop nutrient profile model in China and release it in last year. So we will continue to work with them and to provide technical support and data collection and to develop different type of the nutrient profile model. And for example, the marketing restriction and as well as the FOPL.
Thanks.
Yeah.
Okay, I do have time for one last question to Gabriela. Argentina, as you shared with us, was a really early leader in the sodium reduction regulations. What have been the biggest challenges in maintaining and enforcing these regulations over time?
Gaby, te preguntan cuáles son los principales retos en mantener y fiscalizar la regulación a lo largo del tiempo.
Sí, perdón. Bueno, los principales retos es mantener actualizados los límites, porque requiere una continua disminución de los límites y la incorporación de nuevos alimentos con nuevos límites para poder sostener la política. Y acá el principal problema es la presión de la industria para no bajar los límites.
So I will start by the end. She thinks that the main barrier is the industry's interference because they are constantly pressuring the government to not update the limits. So taking that into account, the challenge is to constantly update not only the limits, but to include more food products into those, or to add more categories that have maximum sodium limits. So those are the main challenges in maintaining the policy over time.
Thank you, Gabriela and Luis. So this was really great. I think we have only just a few minutes before we close out, so I'm going to wrap up our session. First, I want to thank our panelists for joining us today and speaking about their experiences with packaged food data collection and how that's really informed the work that they do and kind of, informed policy development. And I also wanted to thank Nora for sharing about the Global Nutrition Database. As you can see, there are numerous efforts in place on both a national and global level to monitor the ever-growing packaged food industry. And this is really critical because more than ever before, countries are flooded with unhealthy, ultra-processed products high in salt, sugar, and fats. And governments and consumers need strong evidence-based policies to both improve the quality of the food available on the market and to help consumers choose the healthier or avoid the least healthy products available. And comprehensive data collection, like what we've heard about today, really provides the tools to both design and advocate for best practice policies, to track progress, and to identify gaps to improve the policy environment. As you can see from this presentation, there are lots of key stakeholders who have a role to play. We've heard from researchers, Mary, thank you. We've heard from governments, Dr. Flores, as well as civil society, Dr. Kazang. And all groups have an important role to both collect the data, design policies, and in civil society to really advocate for the strongest policies using that data. And collaboration between the three is essential. We hope that the resolve of To Save Lives Global Nutrition Database will be a tool to support these efforts. Obviously, when possible, a comprehensive data collection effort like what has been discussed here is the most useful. But where that's not possible, we hope that it'll be helpful to look and see what other countries' data looks like, how that compares to yours, what changes are possible over time, as well as to understand and potentially what the data looks like in your own country and push for that if you don't have access to the raw data, push for improvements. We hope that the data that we've put together is just a start. If you have data or to share or know of publicly available data that you think should be included in the database, please let us know. We also welcome any feedback on how to ensure that this resource is useful to you and your colleagues, and hope that you'll share it widely. So once again, thank you so much to everyone for joining us, and have a wonderful day or evening, depending on where you are in the world. And thanks for spending the hour with us. Bye.
Bye, all.
Thank you. Bye.